Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Diagnosis and Treatment, Primary, Secondary and Tertiary Exercises, Part 3. Self-esteem is the distance between the image we have of ourselves and the ideal image we want to achieve. The greater the distance, the less self-esteem. The smaller the distance, the greater the self-esteem. Self-esteem derives from what we think we are and not what we really are, as it is influenced by the perception and evaluation we make of ourselves. According to the World Health Organization, 80% of physiological pathologies have a psychological origin or are within the field of somatoform pathologies. The origin of somatomisms and/or psychological dysfunctions is based on a dysfunction of self-esteem. Self-control. The aim of this exercise is to reinforce the patient's self-control. The self-control exercises are associated with controlled behavior. I want you to visualize yourself at meal times. Notice how you eat, just the right amount without going overboard at all. You eat just what you need, with a lot of control, a lot of control. You have total and absolute control over everything. You have total and absolute control over everything you have. Total and absolute control over everything you eat, over everything you think, over everything you hear. You have it all under control, everything. You know that you are able to control everything you want. Another example of self-control will go like this. Now I want you to visualize yourself in the city center. It's noon, it's lunchtime, and you have an appetite. You walk into a restaurant and you can see the multitude of tasty offerings to eat today. Now I want you to see yourself asking the waiter for just a salad. I want you to see how the waiter recommends you several tasty dishes included in the menu of the day. I want to see yourself rejecting all those dishes. You tell the waiter that you are on a diet and you only want a salad. Now I want you to see yourself happy and satisfied with yourself by making the right choice and rejecting those dishes that you like so much and that are so fattening. I want you to see yourself satisfied with yourself, controlled and happy with yourself. Now I want you to see how you have only eaten the salad, being totally satiated without hunger. I want you to see how your figure is gradually adapting to the figure you want to have. It's all due to the control you have over your actions, eating exactly what you should, not eating what you like the most, and getting fat. This exercise of self-control belongs to a weight control therapy. The elements of the diet and their quantities are those expressed by the endocrinologist or the patient's family doctor. We limit ourselves to apply them under hypnosis. Self-control is the conscious capacity to regulate our impulses in a voluntary way in order to achieve a better personal and relational balance. Emotional self-control is the capacity that allows us to control our emotions and not to become controlled by them, giving us the possibility to choose what we want to feel in each time of our life. We are the actors or makers of our lives, since our existence depends on our small and big choices. We have the important possibility to make our life happy or not, in spite of external events. Those events are not the ones that manage our life, but we ourselves, as active subjects, manage our happiness depending on the interpretation we make of them. We are what we think, and if we learn to control our thoughts, we can also control our actions and emotions. Self-concept. This exercise is based on the patient seeing how others see he or her, how they perceive him or her, what they think of him or her, etc. I want you to visualize yourself walking down the street. You walk with your head held high, very high, erect, very erect, and very confident. You realize that guys are looking at you. They are not stopping to look at you. Some even compliment you. They all want you. Everybody likes you. Everyone likes you. They look at you as a beauty. And all this makes you like yourself and makes you walk even more elegantly. Now you realize that others like you and like you. Now you know how others see you. It can also be approached from this point of view. I want you to visualize yourself, to see yourself on any given day of your life, doing the things, actions that you want, wish to do, without caring at all about their opinion. Focus or individualize on one person if it is observed that he or she is the stressor focus. I want you to see yourself doing it. Focus on a specific action applied to therapy if applicable, totally independent of what others think or say. Visualize yourself like that, completely free, doing exactly what you want to do, doing exactly what you want to do, doing exactly what you want to do, but the opinions of others is irrelevant. This self-concept exercise is generalist. That is, it is not applied to any particular type of therapy. Self-concept exercises should be as personalized as possible according to the patient's behavior and pathology. To understand self-concept, it is necessary to understand that sometimes children only develop through approval, and that criticism must wait until the child is strong enough to accept it. In general, self-concept is considered to be the fact of conditioning our actions and our behavior to the opinion of others and not to our own. Therefore, every time an action is carried out, considering that this is the right thing to do from the point of view of others or society in general, but not from one's own point of view, would indicate a low self-concept. It is what we think people think of us, how they see us, how we are perceived by others, and most of the time we discover that the concept we have of ourselves does not correspond to the image we give to others. Self-concept is an appreciation of self-esteem, since it is practically impossible to act with a high self-esteem and low self-concept, or the other way around. Self-concept derives from the subjective comparison we make of ourselves in relation to others, as well as from what they say to us and the behaviors they direct towards us. Personal successes and failures also influence the way we value ourselves. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Diagnosis and Treatment, Primary, Secondary and Tertiary Exercises Part 4. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download self-free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much for your interest.